Hi everyone, I'm in Marbella, Spain, and very excited to have with me Dr Casado, who's very kindly offered to give up some of his time to explain what he does for the trans community and trans women. How long have you been performing voice procedures for trans people?
I've been performing voice procedure more or less 25 years old, but voice procedure for trans people about 10 years ago.
How did you first get started in this field of expertise?
Okay, this is a good question. 10 years ago, more or less, a woman trans came here to my clinic and said to me, I would like to have another voice. And my answer said, I don't know nothing about that, but I am going to study and I am going to go to another country, another places to improve in this. And I went to Finland, in Helsinki, and I learned this surgery and this procedure in Central Hospital of Helsinki, because Helsinki is the most important city for people trans in Scandinavian countries.
What are the procedures that you offer for the trans community?
In general, there are 3 procedures. Every procedure has one objective. The first procedure is stretching vocal cord. The name of this procedure is Cricothyroid Approximation. The second procedure is shortening the vocal cord. The name is Glottoplasty, Wendler Glottoplasty. And the third procedure is to reduce the mass of the vocal cord. And the name of this is LAVA, Laser Assisted Voice Adjustment.
Okay. And then what are the benefits or the risks of those 3 surgeries?
The first procedure, Cricothyroid Approximation, was the main procedure in this surgery. Why? Because it has the advantage that if it doesn't touch the vocal cord. Because in this procedure we do a surgery for the neck. It's an external surgery. We have to approximate the thyroids and cricoids. This is the advantage, but the main disadvantage in 6 months, 1 year, this approximation go to the place first, then the voice again, the vocal pitch go down again. Mm-hmm. This is the reason now we don't do this surgery.
Okay.
Not here in all the work.
Mm-hmm.
The second procedure is Glottoplasty. This is the most important procedure now. The advantage of this procedure is that it has a good result. The pitch, the vocal pitch is high, and it continue high many times, many years. But it has a disadvantage. We have to touch the vocal cord, mm-hmm. because this surgery is for endoscopic surgery. We have to do something like this to stitch in the vocal cord. But usually I have never been a bad result. Only in 2 cases the stitches go out and the voice was exactly the same. But usually the vocal pitch, the pitch vocal is go up. And the third procedure, the laser procedure, is like this. I like to do both procedures together, glottoplasty and laser. It doesn't have advantage, doesn't have disadvantage, but the voice, the pitch usually is not high. Mm-hmm. Usually the women are not happy with this surgery.
Okay.
Then I think the best procedure is glottoplasty with laser in the same procedure. Mm-hmm. They are endoscopic, through your mouth, not through your neck.
And if the stitches come out, can it be redone? Can you do it again?
Yes,
See.
we can do again the surgery. For this reason, it's very important after surgery, 15 days with totally vocal rest. Very important.
And in terms of having a surgery, what's the infection rate?
This surgery, this procedure, is through your mouth. It's endoscopic surgery. Then we don't have never infection.
Okay,
no
that
problem
makes sense,
with that.
yeah. And then, what advice have you got on travelling post-op, particularly planes? I'm assuming if that one isn't surgery, then that doesn't really affect it.
We say to our patient, they don't have problem with plane or with flight, and we write in the clinical report, no problem to flight, no problem. The only problem is to talk. It's very important. Don't speak for 15 days, and don't do exercises, and don't take weight.
Yeah. Okay. And how long is the recovery? I think you've touched on that already.
This procedure has different steps. First is surgery, after vocal rest 15 days, and after is very important speech therapy for more or less 3 months. Then the result, we would like to see the result more or less in 3 months. After speech therapy, more or less 2 sessions in a week.
Okay. And are you able to help trans men in any way? And if so, how?
This is a good question. Saturday, I have a trans man. But usually the hormonal treatment produce a down of the vocal pitch. Usually the hormonal. If the hormonal doesn't work, then we do another surgery. It's completely different. It's a Thyroplasty Type 3. But we must wait. We must wait to look if the hormonal treatment works or doesn't work. In trans women, the hormonal treatment doesn't work, like you know.
Yeah. Finally, what does it mean to you to be able to make such life-changing differences to people?
Probably this is the question I have liked more. Why? Because in my life, like doctor, like ENT doctor, probably is the best situation I have seen in my life. When you see the change, not in the voice, in the life of this person, is the most important for a doctor. This is my main objective in my life, and in these cases is when I say my job, my profession is the best profession in the world, probably for this procedure and for these people. In March of this year, we have published this book. I have published with my colleagues, another doctor in Navarra, in the north of Spain. And this is not only the most important chapter is about voice feminization, but we have more chapters. For example, at the beginning we can see the difference between larynx of a man of a woman. We see the difference. We talk about the terminology, the names about trans women, man, trans. Another chapter is about hormonal medication, hormonal treatment. Another is about facial feminization. This is
facial. Yeah.
This is a thing here in Marbella. The name is facial thing.
Yeah.
These are our friends. Another chapter is about vaginoplasty, is surgery too. Vaginoplasty. And after that, we begin to the chapter about body feminization, exploration, the voice of woman trans. This is the different procedure of the surgery. This is about another chapter only about speech therapy. And the last surgery is about our result and our clinic cases. This is the ENT doctor in Spain all have this book. It was a free book. It's a present for me, for my college. Yeah. We are going to translate English. We are going to begin to translate.
Thank you very much.
You are welcome. Nice to meet you.
Platero es pequeño, peludo, suave, tan blando por fuera que se diría todo de algodón. Platero es pequeño, peludo, suave, tan blando por fuera que se diría todo de algodón.